36-year-old police officer in top shape. I was having visual migraines. I had vertigo, heaviness in my legs, just a general feeling of not being a healthy guy. I was determined that I would have to retire early.
John is just one of 900,000 Americans who get blood clots each year. While things like smoking and cancer can make blood clots more likely, many healthy people can get them with little prior warning. They can die. And black people, who are our primary patients on the south side of Chicago, are 60% more likely to get blood clots than white people. Not all clots respond to current treatment, but we think we found a solution that can treat all clots safely and effectively.
When these blood clots get large enough, they can break off and they can go to the lungs. That's when they become deadly.
My lungs were peppered with tiny little blood clots.
Most patients with chronic blood clots simply are told to wear compression stockings or try to elevate their legs and continue to take their blood thinners. They have chronic pain, they have chronic swelling, and oftentimes they're told that there's really nothing more that can be done.
Treating clots properly is critical to a patient's survival and quality of life. Right now, doctors use a blood thinning medication to stop the clot from growing and breaking off. But these meds don't always work in clots that have been around for a while. Patients can also get a procedure where doctors clear the clot, similar to how plumbers use their tool to unclog sinks.
These procedures aren't without risk. These medications can actually cause bleeding in other parts of the body.
That's why we're working on a new way of using ultrasound to break down the clot and whip the medication around like a tiny tornado to make it work better. We already know this works in newer clots. Now we want to test it in older clots. These stubborn older clots do not respond to the current treatments. They also cause those bad symptoms that limit people's quality of life.
You cannot be idle for a long period of time. I just can't fly safely. I've never been able to take my children to, say, Disney World or Europe.
Techniques like this will restore their mobility, restore their ability to perform their jobs.
Any patients who get blood clots will benefit from this technology, including people who've had strokes or heart attacks, impacting millions of lives each year.